Hey guys, Kirk with Premier. So today I just want to go over 3 different setups that you can use for hip internal rotation, either stretching or PAILS rails or any of the lift-offs or passive range holds that we can use to induce more internal range mobility. So internal rotation it's kind of counterintuitive. It's when your foot comes out. So that actually means the hip turns in. So it kind of rotates on this axis. It doesn't come like this or like this. It's just purely internally rotating. So if we were to kind of set that up, a lot of people like the 90-90 position. It's a great position, but I will say we've gone away from it a little bit with a lot of our patients just because you tend to get maybe a little more medial knee stress. So if you're in the 90-90 position, the internal rotation piece of just the stretch portion, I'll show you here, this setup, you're gonna rotate your pelvis on your downside femur, and then that's how you feel the stretch. So this leg actually in the 90-90, on the internally rotating side, the other leg can come up. So when we're doing internal rotation stretch, we just hold that position. If you're getting medial knee pain, you can definitely adjust the angle of your foot and your knee so you can come into more flexion or more extension. Just see what works best for you and your individual hip. Or you can even move this hip back or further forward depending on your individual hip anatomy. What we don't want is what's called closing ankle joint pain, meaning on the front side or the closing side, if we're getting like a deep pinch in there and we're getting pain on the front part of that hip or even the outer part, we really don't want that. We don't want to be churning through the tissue that you might be predisposing yourself to bigger problems with. So if you're getting kind of a deep pain or pinch with that, you're gonna have to adjust, but if you're not, keep going forward with it, okay? So internal rotation PAILS rails is here, out of the 90-90. The second one that we really like is up against the wall. So I'll see if I can rotate this just a little bit. So if we were here and I was doing my right leg, you can do this both sides, but all you're gonna do is you're gonna kind of find your end range of active. You're gonna come up against the wall, and then you're just gonna scoot a little farther back. So in here, I'm getting kind of a deep stretch. With this, we actually want to posteriorly pelvic tilt our pelvis and come into a little lumbar flexion. So you can see we're not in extension because that's gonna actually close the front side of the hip. So we wanna open the front side of the hip as much as we can by posteriorly tilting the pelvis and getting into a little lumbar flexion. From here, if you want to get further into that stretch, you can even bias your pelvis to turn a little bit to the right. And you're going to feel that a little deeper. So that would be the second setup that we use. The third and final one would be just the opposite of that one. And this one actually works best with both feet. So from here, you're going to be 90-90 this way, okay? And then you're just going to find your end of your active range. So you're going to squeeze out. I'll do both legs here so you can see. And then you're just going to walk your feet out a little farther. So the same rules apply. We don't want like a deep pinch in the hip. So you might have to come away from the wall a little bit to open that angle. If you don't get a pinch, feel free to keep it as close to the wall as you can, okay? And then from there, just walk your feet out until you're really at your end range. And you're gonna notice a deep stretch in there too. If you were doing one side in this position, you could even cross your leg over and give yourself more of a stretch. Okay? So again, everyone's hip anatomy is a little different, and you're going to need to adjust the setups and then the way you're even setting it up. So there's 3 base positions, but inside those positions, there's multiple different angles that you can choose from. Again, try to get the one that's getting the most stretch on the tissue, but is not causing closing ankle joint pain.